On behalf of PD Hinduja Hospital, I invite each one of you to the webinar on pulmonology today. We have Dr. Kinjal D Modi as a speaker for today's session. Few words about Dr. Kinjal D Modi. He is a consultant pulmonologist at Hinduja Hospital, Khar, and other hospitals in suburbs. He has passed MD in Pulmonary Medicine from Nayak Hospital and DNP Respiratory Medicine from New Delhi. He has been the recipient of the Fellowship Award from American College of Chest Physicians and the Hermes Diplomat Award from European Adult Respiratory Medicine. Dr. Modi has received the interventional pulmonology training from Malaysia, and he's been the postgraduate in hospital management and medico-legal services. He has many international and national publications to his credit. Along with being a marathon runner, singer, poet, he has also been an active member of various medical associations. He will be speaking on the topic, is asthma really reversible? Now I request Dr. Modi to please preside over the session. Thank you. Over to you, sir. Over to you, sir.
A very good morning to all of you, and I am very glad that people are very eager to know about asthma. I will share my screen now. My screen visible to all? Okay, fine. Okay, so basically the asthma theme for this year was asthma care for all. So what that includes is that people should be aware of asthma, number one. And second thing is the asthma care should reach to all the asthmatics who are in need of. So that is what the main intention behind having that theme. Let's see how much we can fulfill at what is the awareness part of it. So I bring regards from PD Hinduja Khar. For me, there's some disclaimers because we are having only a friendly talk on the asthma awareness. Now, the first question comes to our mind, is asthma really reversible? Is doctor joking or what? So that things generally strike our mind. So that was the main, that keeping a topic was if our brain had some storming effect, that is generally what has been said, asthma reversible, yes or no? But I am not joking. Asthma at some stage, basically mild one, moderate one, generally are reversible very nicely. Severe, or we can say the more fixed obstructions ones are difficult. So if you can say all asthmatics are reversible, they may be not. But the early stages ones are generally reversible and easy to handle also. But unfortunate part is that what we see in the current scenario, though we say asthma is a reversible disease, but it is the most ignored disease. And this sentence is very important, as out of 100 deaths in the world occurring due to asthma, 44 is occurring in India itself. So that is a very bad number. We can say asthma in India, or Bharat basically, is the world capital of asthma deaths. That is not a good news for us. It is unfortunately a mismanaged case many a times, partially supervised, and still the term asthma still remains a taboo. So giving a diagnosis, especially in a younger generation people, means especially in the younger group, pediatric people, if you say asthma to them, parents do get offended. Why can my child be having asthma? Or basically, if some people in themselves feel like that, how can I be asthmatic? There is no asthma history or something like that. There is always a taboo, or we can say a negative thought behind it, that I should not be having the disease. So unfortunately, what happens because of that, that there is a lack of awareness of the people who are suffering from asthma itself. They think either it is some breathlessness, age-related things, some weight-related issues, they have not taken proper food, that is why they are breathless. So there are various reasons that we apply that why they are breathless. There are misconceptions regarding inhalers also. Inhalers lenge, so basically we will aadat lag jayega, we will get used to it. हमको नहीं लेना है, वो तकलीफ देगा. People hear about steroids, they think, oh, steroid लेगा तो हमारा जीवन खराब हो जाएगा. So there were lots and lots of misconception about it. Unfortunately, only 10% of people, only 10% of people actually on proper correct treatment, who are diagnosed asthmatic and on proper treatment. 90% of them are unfortunately misdiagnosed, we can say under treatment or wrong treatment. So that is a fact which is happening in our own country today. And to add more to it, we have non-medical treatments, we can say non-allopathic treatment specifically. We have fish therapy, which is occurring every year. There is a particular dates, and I think so, state of Karnataka, and they have a particular day fixed. And on that day, people have fed fish to that to cure asthma. That is what been claimed. Don't know how to do it. And we always know Gaumutra is always blessed that they can treat anything. So in India, we do face these issues also. It is not irrelevant or not out of the box things. This do happen. So practically, let us come to the definition of asthma. I won't go into technicalities in this lecture because this is just an awareness lecture, but there's a definition we should know. It's a chronic airway disease, inflammation especially, and it is generally has symptoms like wheezing, shortness of breath, chest tightness, coughing, which vary over a period of time. It is basically variability in the intensity, and there is a variable expiratory airflow limitation. So this is the thing about asthma in the definition point of view. I'll make a simple definition, but one more thing to understand is, however, airflow limitations become persistent, which was variable mentioned here, becomes persistent later in the course of disease. This kind of patients are difficult to get reversed. But in the initial part, when there is a variable component attached to it, reversibility is generally possible. Many of my patients have given affidavits and they made a video. I have them posted on my YouTube video channel with their permissions. So basically, people do get better with the asthma and they live a nice life after completely off treatment for years together. So making a definition more simple to understand, it is only two things. It is ROAD is a short form, is reversible obstructive airway disease, and BHR is bronchial hyperreactivity. What does it mean? Because of reversible airflow obstruction, there is a bronchoconstriction, that the airways get constricted. So the passing of air inside the airways becomes difficult. And that is why a person feels breathless. And inside the airways, we can see there's inflammation. But the skin inside the bronchus or bronchioles or all the airways, we can say, get inflamed. And that is why anything, any allergen, any antigen, any infection particle going over there, stuck to that inflamed wall, the wall means the bronchus gets constricted and the symptoms of asthma starts. So treatment is also very easy as we understand. So if you have bronchoconstriction, you have bronchodilator. If you have inflammation, you have anti-inflammatory. It is clear, broad spectrum treatment for this kind of disease and very easily available also. We won't go in much details, but only thing we should be aware how things work. So this was the definition part of it. I want to mention something about, especially in pediatric asthma. There is something called as a rule of 1/3, especially with respect to the reversibility. If you take 100 asthmatic patients in the pediatric age group, 1/3 means 33 of them, by the time they reach teenage, means 13, 14, 15 age, that age group, either that asthma vanishes on their own and that remains vanished throughout the lifetime. So it is totally gone. So that 1/3 is actually, we can say, cured by itself. Okay. Now next 1/3, it goes off and it may come in the adult age after a couple of years. That is second group. Third group is last 1/3. In that, disease prevails and may worsen or remain the same in adult age also. So in which age group that asthmatic child falls in is not, no one can predict that. But what is our aim is that we can have to treat each and every child with a proper management so that they don't suffer during their childhood activities like running, walking, sports, whatever they want to do. Asthma should not stop you from doing whatever activities you want. Okay, we must be having aware. I'm not sure. Many celebrities like Priyanka Chopra, Amitabh Bachchan, even Bill Gates, at one, basically all these people. I'm not sure Bill Gates, Bill Clinton, sorry. So this kind of people are asthmatic and they're on treatment. But have you ever seen that they got hospitalized because of asthma, or means they are in emergency management or emergency room for taking nebulizer for asthma? No, because if you take a proper treatment, generally you are fine and generally remain better, and you can do whatever you want. So that is what is all about the asthma management. Now, how do we diagnose it? So, is anyone aware how we diagnose it? If anyone can have a put their thought on the chat box, I would just like to know. What is the diagnostic thing for asthma? For diabetes, we only know blood tests we do, sugars we do. So basically, we have some test for diagnosing asthma also. So if is anyone aware? We have many people around. Yeah, very nice. Someone says PFT test. Someone is saying breathless pulmonary. Okay. Any more people who are awake? I think so. I have a habit of asking questions. So basically, people are awake during my lectures. Difficulty in breathing. Okay. Fine. What other people are Mr. Deepak Shroff and Mr. Sundar, what they're trying to say is it is about the symptoms. Okay, symptoms do play a role in clinical setting, but that I've already discussed with breathlessness, shortness of breath, coughing, wheezing, all these things do happen. Chest tightness, they are symptoms. That is fine. Because clinical we think this patient is having asthma. So what further we do?
Are you
Okay,
wearing
good.
headphones
We
and your
test. Once take rotaler, then it's okay. Okay.
Zoom?
This is trial and error method is what Mr.
क्या
Sundar is
हो गया
trying to say.
वॉल्यूम को अभी तक?
Good. Okay. Fine. So a couple of answers, nice answers. I appreciate them. So public is awake at least on a Saturday morning. So most of people are trying to say is
Yeah, but
okay,
again you'll have to give me
we
the
have
number. Close करूं?
spirometry basically. Yeah. There is spirometry test, but spirometry test has to be done with the bronchodilator reversibility test. You can see the word reversibility is again because
I have to
the
come out
basic
of it.
motto of diagnosing an obstruction with the reversibility. That is the basic motto behind diagnosing as asthma. So if it is not a reversible disease on a spirometry, the diagnosis itself does not come out to be asthmatic. So if we have a breathless patient who has coughing, chest tightness, wheezing, but if that patient is not having a bronchodilator test positive, means if he is not having a reversible airway disease, should we label him asthma? Ideally, no. There are a few cases where we can, no doubt, but there are subject to case basis. But on the general basis, no. So there are other diseases. This non-reversible airway disease, commonest is the we can say COPD, small airway disease. There are small airway obstruction monitoring we say refer to them. So these are other airway diseases also occurring in the lung conditions which are not reversible. Okay. So all these things which is reversible generally falls in the category of asthma or asthma-like diseases basically. Like asthma, why? Because there is something called as a bronchodilator reversibility, which is generally very specific to asthma only. There's a guidelines also for it. 12% at 200 ml according to ATS guidelines and according to BTS, which is British Thoracic Society, 15% reversibility. That's what the person blows in the machine. They do the testing and found out how much lung function, how much it is, and then they give a bronchodilator. Ask them to wait 15-20 minutes, and then again they check the same test and then see the difference. The first time, if the lung capacity, suppose it is, we can say 60%, and after doing the test, if there is an increase in that FEV1 especially by more than 15% or 20%, we can say, then it's diagnosed as a asthma. The condition is diagnosed as asthma. So that is the whole reversibility comes here also. So in the definition, reversibility is mentioned, variability in the airway disease. In the diagnosis, again, reversibility is there. In the which what we say, disease progression itself, in the pediatric age, that is why I mentioned that it can reverse by itself. It's possible. It's not that always doctor treats an asthmatic patient. God is above all of us. So if he wants to treat you, definitely no one can help you with that. So definitely there are reversibilities occurring everywhere in asthma. As such, if we say allergic conditions, it is generally, commonly it has been said one thing is good, one thing is bad. Good is it is always reversible. Why? Because if we treat it becomes okay. But bad is it might come again if it's not properly treated, or if the allergy comes up again. So asthma also falls in one of the allergic conditions many times. Otherwise, there are other causes also for asthma. But a major chunk we can say allergic is one of the uh, uh, caveat in which the asthma falls. So 1, 2, and 3 things we have seen. Now we go for the treatment part of it. So how we see the progress once you have given the once you diagnose a patient asthma, we have started the patient on treatment. Treatment generally we have inhalers, as we all have been aware of. Inhalers of multiple varieties, and not going details of. I'm not going to bore you with all those things. Not going to any details about it, because it is based on case to case basis. What your lung function is, what stage of asthma you fall in, mild, moderate, severe, and all these things, or which is intermittent asthma. Depending on each and every person, the management varies. If you have questions regarding that, I'll be happy to answer after the end of session. But thing is that the management of asthma, generally we are very keen on treating them with inhalers. Various types of inhalers are there. Rotahalers we have, inhalers, MDIs, if you have many times seen. But generally that only MDIs we are refraining from use for more than a decade now, because that inhalers must be seen by movies and web series, or wherever you are seeing the people taking asthmatic pumps, like put 2, 3 times they pump it, breathe something, and then they leave it off. That is not a technique, correct technique. Correct technique generally is you to breathe in and to press and breathe in simultaneously, and then hold the breath for 10 seconds, and then release the breath. But it's common sense, we understand that if you are breathless and if you have asthmatic attack, at that time we won't be able to hold the breath for 10 seconds. So when you need the most, that time won't be holding the breath for 10 seconds. So that doesn't make sense that using that medication on a regular basis, or that instrument on a regular basis. So only in inhaler, basically most of chest physicians have waned off than the practice. They give it with the spacer. That you must have seen a spacer tube, basically commonly used, and that is very commonly used for treating the patients. Okay, so there's other options available. We have nowadays breath actuated automatic devices available. So it was very easy to take. So there are various options available depending on patient's need, patient's pocket. Now, all those things has to be seen. The patient's technically how sound they are. All those things are seen, and then the inhalers are generally discussed and finalized on that aspect. So that is fine. So person is on inhaler. And there's one more thing on inhalers. Basically, people always ask me that question, sir, inhalers ही क्यों? Oral therapy क्यों नहीं? Why not a tablet? So that's right. They are correct in asking that question, because the moment we go to a doctor, we always been taught that doctor के पास जाएंगे, doctor गोली देगा, and गोली खाएंगे ठीक हो जाएंगे. So that is a common sense and common thought process in our brains since many years together. But that goli which is given to us is only in somewhere milligrams. For example, if you say crocin is generally a 500 milligram tablet or 650 milligram tablet. So that milligrams, okay, that goes in the stomach, intestine, get absorbed and go in blood, go everywhere in the body where it is not required, and goes in brains and basically has its functions over there. Okay. So same way for asthma, if you give some tablets, it will go the same way, go to all other organs which is not required, and then go to lungs where it is required. So definitely it is going to have side effects from the organs where it was not required to be born, right? So that is one thing. Second is, if we give a pump, it directly goes to the lungs. So targeted therapies, okay. Next is dose, what we give. The dose in the pump is only micrograms, 1000 times less the dose. So that is very low dose. So that is quite good. So less dose going in a targeted therapies, that is what we required. So nowadays, if we see what our military is doing nowadays, they don't produce big missiles. They produce targeted missiles. Means, fortunately, if they have fixed the latitude and longitude in a particular place, XYZ, and they just have to press a button and it will go and land in that place and place is gone off. So they don't have to blow bigger area. They can have a specific marker and things goes there and things are getting over. Same thing happens over here. Directly giving a pump directly going in the respiratory system where the effect is required in a very low dose. So medicine also not wastage and very cost effective to patients. So that's all about the management part of treatment part of it. Now, but if the patient is on treatment, okay, someone is taking a pump, someone is taking some inhalers. Now, how do we check the progress of that kind of patients? So we have this kind of a chart which is given by GINA guidelines every year. They make new guidelines and give it to us. For all of you to just tell you last 2-3 guidelines, they were very specifically told that don't use only inhalers like Astalin or which contains only salbutamol. Those should not be used in asthmatic. That is 100% you should take in your brains. One of the take-home message which I will love you to take from this webinar is don't take only Astalin as a treatment for your asthma. And if you have it, please throw in dustbin. It should be having some amount of steroid with it. Okay, that is still okay. Otherwise, only inhalers we are taking for a treatment, it is more detrimental. That asthma deaths, what I told you, the studies, what have been done. I don't want to bore you with the studies, but only one line is only SABA means short-acting bronchodilators like Astalin been taken for a long period of time. It is a higher mortality than not treating the patient at all. You understand? So doctor means God will let you live a long time more than if you're taking only SABA, you'll die early. So don't make that mistake. Okay. So always an inhaler in a asthma patient should be containing a small amount of inhaled steroids. And remember, the word is inhaled steroids. It is not oral steroids generally required in a asthmatic patient. Till if the patient is not responsive to the many treatments we have started, first line, second line, third line, still not responding, then at some point of time we might require oral steroids, or in case of exacerbations in some point of time for a short period of time. It is generally very safe and not long-term side effects at all. Side effects for steroids generally occurs when it is unsupervised, long-term, and high doses. These three terms are required to have a side effects of steroids, oral steroids. And oral steroids do have side effects right from your head to your toes. So I am not denying that side effects don't occur with oral steroids. They do occur. But inhaled steroids, rarely. And inhaled steroids, generally, if you see, when we take a pump, it goes through our mouth and throat. So generally, ask a patient to have a gargles after whatever inhalers they take, so that whatever small amount of steroid which have stuck to their throat is also washed off. So no side effects, no systemic absorption at all. So no side effects at all, right? So these are the simple things which is very helpful in asthma management. And that is why the patient is getting better with the management. Now, suppose patient is there, comes to you after 2-3 months. What we do? So basically, this is a above part, which is a circle. And we generally keep on assessing this kind of patient on a regular basis, and then we adjust according to that. And finally, we review with that kind of thing if the patient become better or no. If they are becoming better, great. If they're not becoming better, we again adjust the dose, increase depending on that. But this cycle goes both the directions. Patient become better, we decrease dose also. We have a next slide for that. So I'll mention how it goes on. And below this, the second half of the slides, if you see, there's control therapy and reliever therapy, what they mentioned, alternative therapy. So this is step 1, step 2, step 3, step 4. Basically, how they go about is they go on increasing the dose of the medications depending on the stage of the patient, on the PFT staging, as we have discussed this spirometry. What patient does, the patient is having mild asthma, some lower therapy, moderate, higher therapy, severe, more higher therapy. So these are technical parts. Just to mention, I have shown this slide. We won't have to go much in details about it, but there are some step-wise therapies which do occur in asthma, which you should be aware of. So now, just to make things very simple, it is a continuous process. So the patient comes to you, you see the initial therapies in 3 months. Basically, you see doing a spirometry again. If the patient is well controlled, well maintained, okay, step down therapy. And if the control is maintained, fantastic. If the control is not maintained, the patient not well controlled, symptoms are not getting controlled very well, patient is requiring rescue medications more than twice a week, is partially controlled. In all these conditions, we need to increase the therapy for a couple of weeks to months, and depending on that, we go ahead. So this depends on the whole cycle, depends on the reversibility of the patient. The patient is improving over a period of time, Then slowly the disease improves and we lower down therapy slowly. And then we keep on checking the PFTs, PFTs remaining normal, and medicine going on the lower side. So that way it happens. PFT remains normal and this is medicine going in the lower side when the patient assess. The initial part, the PFT we have to increase, so medicine also we have to increase in the initial part. But once we achieve generally 80% of the lung function, what we generally want according to patient's height and age, that is what we generally want in patient condition. And if it's achieved, then we start reducing therapies. So that is a continuous process. So maybe in a couple of months or maybe a year or so, the reversibility do occur in most of patients. Maybe off treatment also. But off treatment also basically we generally advise them to at least take 6 monthly or yearly PFT so that they are aware of the lung function deteriorating or not. One more point, just as I remember, is most of patients generally may have asthma, but they have never been aware that they have asthma or they have never checked it is if do have asthma or not. Because few of my patient I remember was she was a singer. She came to me and she just told me, sir, I don't have any breathless anytime, but when I go for the higher source, I am not able to cope up with that. So generally, I was able to do it a couple of months back. For a couple of months, when I'm trying to practice, जब रियाज करती हूँ, तो ऊपर के सुर नहीं लगते. I have to strain a lot. So that was a simple complaint she was telling. There was no breathlessness, no chest tightness, no coughing, nothing. I just did a spirometry test and found that she was a mild asthmatic. With treatment, she reversed back, and then finally she could swing like anything. And she was off treatment also very fast. But this thing brought to notice, brings to our notice is that many times we are not even aware that we are asthmatic. So what happens in this kind of condition? Why do we have that thing? Miss asthma है मुझे पता नहीं ऐसे थोड़ी हो सकता है सर पॉसिबल ही नहीं है तो मैं समझेगा ना breathless होना ही चाहिए मेरे को. So just to give a simple example, as God has given us two kidneys, so one kidney we know that we can donate and we can live a normal life with one kidney. Similar things happen with lungs. We have given two lungs. So two lungs means what? Basically, one lung is totally extra. We can definitely donate one lung, and one with patient can live fantastic on one lung. I have many of my patients who are living on one lung for years together now. So it's very much possible that on one lung you can lead a normal life. What does this mean indirectly? That if 50% of lung function is gone, you won't have a single symptom. So it is not your fault at all that you don't have a symptom, because the extra part of your lung is gone till now. From 50% to 75% lung becomes bad or gone. Then you have symptoms on exertion. Means what? If you are exerting, straining, then you have symptoms. But as Indians, we are very smart. So we generally ignore those symptoms also. Like we say that आज थोड़ा कम खाना खाया था इसलिए, आज मैं थोड़ा ज्यादा चढ़ गया इसलिए, आज वो थोड़ा वजन उठा के चढ़ा या चला इसलिए सांस फूल गया, otherwise मुझे सांस फूलता ही नहीं. So we ignore that part of it. When more than 75% of lung function is involved, at that time we come to know that unfortunately or fortunately we are feeling breathless from one place to another, and then generally consult a doctor. But no doctor on this earth unfortunately has a magical wand in his hand, and with that he can clear asthma from 78% to zero. That's not possible. So thing is, they can try with best of your conditions. We can just reverse whatever best we can do. But if you reach the therapy late, reversibility chances are less. Early diagnosis, early treatment is the main thrust. That is very important. So now we also should understand there are some associated conditions also to be treated along with asthma. Generally, there is some allergic rhinitis, sardi khasi, post-nasal drip, some sore throat or something people may be generally having it. GERD, that is gastroesophageal reflux disease, acidity, and all those things people do have that also be treated simultaneously. Exercise, basically we should be telling patient how to do proper exercising, and so that basically the asthma part is cleared very nicely. And either if the exercise induce asthma, then to avoid and what to do and what not to do, what ways to advise accordingly. There's aspirin induced or allergy induced. In that condition, we have to categorically tell patient how to handle those kind of conditions. In pregnancy, the one more thing is that in females during pregnancy, some people do feel breathless during the pregnancy episode. And once they deliver, fantastic. Then again the things goes up. Again, that also happens 50% of cases it goes up at all. And some people basically they are asthmatic. Some people who are asthmatic, when they become pregnant, they fortunately becomes off therapy. They don't require anything because because of that hormonal changes occurring during the pregnancy. Some pregnant ladies become normal by themselves. They don't even require the pumps by that time. And by delivery, after delivery, again they start having breathlessness and again they require. So symptoms wane off during the pregnancy period. And for some, basically it may escalate also, but that depends on case to case basis. So that is the relation with pregnancy. After the sleep apnea, snoring, that is one of the we can not say at the pandemic level, but unfortunately again one of the ignored medical conditions which we have to address and treat on time to prevent further complications of it. Occupation do have a general effect on asthma. One of a patient who was a painter, but no allergies, even the or the allergy blood reports were negative. But when we go on history, basically found out that when we go for work, then you become breathless. Then he found that basically he was a painter and with this sprays and everything, he could have what getting worsened, and that is why the things were not good for him. I upload a few slides in this to have some lifestyle modifications. I just go through the slide more to complete the lecture. Generally, people do ask me some questions regarding the lifestyle modification, diet, and stress and exercises. So I put some slides over here so people can understand how to go about it. The nutrition, yeah, many antioxidants like all this, I think plants I mentioned over here do play a role. Vitamin D3, again, if it is given in good quantity, definitely is going to be helpful. And anemia definitely has to be treated. Otherwise, whatever best oxygen is given to the lungs, it won't be carried to other body organs because hemoglobin is a carrier. So if it is not taking oxygen to the blood, all people around, things are not going to be happening good for them. Exercise, yeah, the exercise many times trigger the asthma also in some patients, but at some exercises like swimming, yoga, aerobics are good, and they can definitely be taken for this kind of patient. But how good they are, and early morning exercises generally morning walk, simple on a seashore or basically along the garden is very helpful. And this kind of things can be taken up very easily. No strength or no stamina, much stamina is required. And with that, we can generally get our endorphins released. Endorphins are in our own steroids from our own body. There are endogenous steroids, what we call as endorphins, and they give us fantastic effect throughout a day. So if a person regularly going for morning walk or jog, they must be aware. If they don't go for a day or two, they themselves feel very depressed. They're not going yet and they're not feeling good throughout the day. It happens many times. So if you go regularly, definitely these are going to be helpful for you also. Some people say exercises, yoga will reverse your asthma. So that is not true because I am saying there have been trials for thousands of patients taken on one side and thousands of patients on the second side. One side was the basic treatment, second thing basic treatment with yoga was added to it. Yoga basically, yeah, if you do exercise as I told you, you feel that energetic, you feel the endorphins being released, you feel very good, nothing wrong about it. But that does not reverse or increase your mLs on your spirometry. So that was not shown in the lung function increase. Right? Only doing yoga is not going to help to clear your asthma. It is helpful, yeah, as a general well-being, definitely good for you. Please do it. I'm not denying that. But if you think on the basis mein yoga karega aur main asthma ठीक हो जाएगा, that is not the criteria. Then you might not be having asthma itself. That is one thing to understand. कि आपका asthma ठीक हो गया था खाली yoga करके. So was it actually yoga, actually asthma to start with? So that is also one thing to be taken care of. There is a reason for being breathless apart from asthma in respiratory system. So stress in Mumbai, I think so all over the world nowadays, not a single person will be there without any stress. So unfortunately, it's part and parcel of life nowadays. But yeah, the best profit, the best techniques, if you do meditations and can settle your stress and you can reduce the stress to minimum levels, is very helpful for controlling asthma also. Sleep is the most important thing we have always to understand. Unfortunately, there are various videos we've also seen that nowadays that your social media, especially Netflix and all these particular platforms where we see the videos, films, and all those things very frequently. Unfortunately, people do binge watching in the night time because they think that night तो अपना ही है ना दिन में काम करेगा night में थोड़ा news देख लेगा We are happy, but we are basically eating your sleep time, and that is worsening your health. It has been proved with all the studies been done that if your sleep time is reduced, then your allergy, if you're allergic, then basically allergy worsens. Okay, so that is not good. Your asthma worsens. So if you should have a proper sleep in a proper environment, that's very important. So can something be done for it? Number one. So generally, yeah, we have some techniques and some ways management. Everything is fine, but on the overall public view, can we do something for it? Yeah, we can have a dedicated asthma clinic, which we had actually pre-COVID. We at the Hinduja Khar, we have started asthma clinic very nicely, but unfortunately during the COVID period we could not have continued the same thing, and we are restarting it the same in some time now. So what is that all about? Basically, that we know that a single doctor, a single person cannot be treating you like anything, right? Like winning a match with only Kohli is not possible. It's a teamwork, right? Entire team has to play some role, and then basically, as you saw yesterday's match between Mumbai Indians and Gujarat Tigers, some of you are a fan for IPL. I'm not a great fan, but sometimes I see. Surya Kumar was a good player. He started playing nicely, but because only one player you cannot win. So that is what happens. So what is we require is our team of trained technicians and the people who are handling the patients. So definitely they will be helpful for the management of the patients. So that was the last slide for me. Thank you for being with us for about 45 minutes now. Anything else if you want to ask me, I'm there. I'm in the chat now. So if you want to ask any questions, let me know. Some questions I think so have come up. Let me see if I can answer. Yeah. Hmm. Zero flow rota caps. Okay, that Professor Agrawal has mentioned, but 400 is okay. See, what is okay for you and not okay for me, because even our 5 fingers are not the same. Okay, so giving only one drug to all is like blanket therapy. That cannot be. All asthmatic should be 400. No, what stage you are. You should find out first. I do mild asthmatic, moderate, severe, or you want only intermittent symptoms only. Then you don't require even 400. So thing is, depending on your stage, first find out what your lung condition is, and then think about treatment. That is the answer I think so for for your for Professor Agrawal and Mr. Sunil. Next, I go for the missed the last part about gargling. Okay, so gargling basically, whenever we ask the patient to take a pump, gargling is always advised, especially with the if it is steroid containing pump, because whatever generally when we inhale in the mouth and the throat, some amount of drug get deposited, and they should not get absorbed and cause side effects to the minimum level also. That is why I ask them to inhale so that they don't have local side effects and they don't get absorbed also. So that is why gargling after a pump is very effective. So this was, I think, so Mr. Franco had asked. So, what about Foglin and Formtide 400? See, Foglin is a combination of two bronchodilators simultaneously. So that was basically introduced by some of the companies, two bronchodilators together. It does not contain inhaled steroids. So it is a good product for we can see a COPD patient or small diabetes patient at some point of time, but not for asthmatic to start with. Formtide is similar to Foracort 400, which is generally just answered a couple of minutes back. But basically, Formtide 400 or Foracort 400 definitely are the used in treatment of asthma, no doubt about it. But see, 400 is the higher dose of steroid. So generally, I don't prefer giving a higher dose of steroid in the inhalers. I will go, I may be requiring 400, it's fine. But when we give a inhalers, if you give 401 and the patient take an extra dose, if they're not feeling better, if he goes to office and they're breathless, they take extra dose. And suppose he comes back when he's at night, again he requires suppose a pump, extra dose. So morning, evening, 1, so 400, 400, 800, plus 2 extra, 1600. So that is crossing the limit of what is required, but what is allowed in the daily system. So that is very easily possible if you take 1 or 2 doses extra in a day. So if possible, get your steroid content in your pump or inhalers on the lower side. You can take multiple pumps, that is possible, but getting a higher dose of steroid does not make you that you are taking a good pump. No, multiple times basically. Yeah. Okay. Is ice cream bad or good for stomach? Fantastic question. I love that. Deepak, Mr. Deepak Shroff, fine. My patient do ask me, and many times we see that once my patient diagnosed with asthma, we have a long list being given by some doctors, so-called doctor. I don't know. Many times people give, some people don't give. But you should not be eating this, should not eat this, should not drink this, blah 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 blah. What I advise for my patient is till the time they are on proper treatment, means they come to me. I generally assess with the blood test and routine investigations. Once they're a bit better, I do a PFT just to make you sure, make understand pulmonary function as PFT, spirometry, what we're discussing, should never be done in an emergency basis. When you're bad, no, it should be done only in a stable stage. Once you're a bit better, because if you are doing it in a bad condition, definitely won't be able to do it properly. Second is, if you do it also, it would be very bad. So you will be in a very bad shape, and receiving yourself also be feel very bad that I'm in such a bad shape. That is not required. And also get it done from proper place, because PFT reports, PFT technician who is doing the PFT reports has to be well trained in doing it. In our hospital, in Hinduja and other places, definitely we have trained technicians who are doing only spirometries. They have no other jobs. But in some centers, I have seen they want the person who's doing X-ray and person doing a sonography help. Also, the same technician is doing spirometry. Also, not very well trained. He just says puko puko puko. Give some medication. Sometimes they don't give medications also, and thus they send the patient off. So that kind of test is not of any importance or any diagnosis of any diagnosis or diagnostic help also. So getting a spirometry done at a proper place is also very important. And after spirometry is done, patient is a proper treatment, then I ask them to take whatever they want. I don't mind them. I only just say, okay, if you want to ice cream also, you can take it. But only advice is you should not eat like a uh, like with scoops and scoop. You can just go slow, like leaking and slowly going for the ice cream. I generally give an example. You see how a cat eats the food; it leaks. So you can have ice cream slowly. You can enjoy your ice cream unless you are allergic to some flavors. Avoid them. Otherwise, when you can lead a normal life with your taking ice cream in a moderate quantity and can enjoy whatever you want to do with treatment on. Okay, so next question is once a day in 24 hours, I take Foracort 400. Is it effective? Mr. Sunil, you are doing more harm than good in one sentence you want to say. I'll explain what I'm trying to say is because people generally have a habit कि मेरे को ज़्यादा pump नहीं लेना है. Good that at least you are taking pump, that's good. But taking other, मैं एक ही बार लूँगा सर, तो मेरा काम हो जाएगा. So then you're actually wrong pump. You take a pump which work 24 hours, right? तो आपको 24 घंटे में एक ही बार लेना है तो pump 24 घंटा काम करना चाहिए ना. But Foracort what you are taking contains medication which work for only 12 hours. So what is happening is that you are taking a pump which opens the airways for 12 hours, and then medicine is not given, so that closes for next 12 hours. Again you give it, try to open it, again you don't give, close it. So your airways which are already constricted, already in trouble, उसको ज्यादा काम करवा रहे हो. ठीक है, उससे जो रखा वो पोजीशन में रखो, वही अच्छा है उसको. If you don't take it, it's more better than you, because you are getting it more and more trouble to the airways. Sometimes they will get constricted on a very bad level, and they will end up in problem. So always take both the times, because it's 12 hours. So take one puff in the morning, one in the evening, 12 hours apart. That is always advisable. Generally morning, I always advise to take moment you wake up from your bed, you can pray to God and take your pump on the spot that time only, and then go to washroom for your brushing your teeth and all those things, daily activities, because after a pump gargle is required. So once you take a pump and go to washroom, definitely going to gargle. And in the evening part of 12 hours, remember that definitely you should have been taking the pump and you should be gargling it properly. That is also possible. All right. Okay. So next question, someone has. We'll take 2 or 3 more questions and we'll stop it. Right? What help does Monter LC, okay, give in prevention of asthma? See, Monter LC basically, again, is basically what Mr. or Mrs. Franco, I'm not able to know, but I think Mr. Franco mostly. Okay, so he is trying to ask is Monter LC generally used for allergic rhinitis for treatment point of view. Controlling allergic rhinitis is very important because if it is not controlled, your asthma won't be controlled at any point of time. So Monter LC is good for your allergic symptoms related to nose. Some studies, and some actually there are only one or two studies that we have come across. They have did a study that if we don't want to use a pump and we only monitor LC and a proper dilator, do that patient become better? In mild cases, they found that yeah, definitely some effect do come, not that much, but yeah, those kind of patients, somewhere if you're going at some point of time, वहाँ पे pump नहीं मिल रहा है, yeah, unfortunately you have finished your pump and not getting it if you are traveling up at some point of time. A monitor LC and a bronchodilator can save you for a couple of days. It is possible. I'm not saying that what stage you are and what you definitely going to help or not. Definitely to take your proper medication when you travel and along with you. Don't rely on getting from your place where you're going to go. But monitor LC itself affecting asthma directly no, but yeah, definitely it has a role for controlling the allergy part of it and helping it off. And some studies recently has come to mention that monitor on a long-term basis has been found in United States to have some suicidal tendencies more compared to the placebos. So that is a one new study which has just recently come up. So just blindly taking monitor LC for a long period of time unsupervised is not very advisable. It will also remember that. So I think so. Second person also asked the same thing. Montec BL. Montec BL is Bilastine. Bilastine is a younger brother of levocetirizine. So that is the same thing. It's a milder medication than Montec LC. Doctor, I have asthma for more than 30 years. I am 53 now. Okay, taking inhalers, Utaka, etc. Did all the types of medicines or medication remedies. Now living with it. Yeah, good. Okay, I understand. At present, doing Ayurvedic medication. What test should I do to know my lung condition, madam? If you have been, madam, I'm not sure who I am. If you have been asthmatic for 30 years, long years, you are not the lone person in the world who has been not properly tested because there two happens. In India, we had done a study which you found that asthmatic patients being diagnosed asthma by some other means the doctor mentions if the patient knows I'm asthmatic, they have not done a spirometry in 2/3 of the cases. As I discussed in the lecture, one of the fundamentals in diagnosing you of asthma is spirometry. Spirometry किया ही नहीं है आपका और आपको asthma लेवल कर दिया तो क्या बोलने का फिर? You understand? That is unfortunate, but that is happens in India. That's a fact. I take it once a day when it is difficult or uncomfortable. Okay, these are the people. Yeah. So I will sorry again. So they take it when they require. That is again also as I told you. See what stage of asthma you are in. If you know that first. If you are in a intermittent group of asthmatic group, it is intermittent is basically your lung function is about 80% and symptoms occur on a irregular basis. That is fine. When then those conditions you take in on a irregular basis, that is fantastic. But if your lung condition is showing that if you are a mild asthmatic or a moderate one and persistent one, then basically you need to be on a regular medications. Okay. Professor, zero flow rota caps daily, alternate days. Sir, as I already mentioned, don't do this gimmicks. Humble request, Professor Samat Kariye. And Montana L alternative nights. So a humble request with both hands. Please don't do that. Any more questions we have? I think so. People are getting exhausted with their questions, and it was a good time interacting with all of you. I think no one is typing further. So it's all over from my end. Anything else you have, you can definitely contact to our team over Hinduja and can come back to us. Thanks a lot for patient hearing and sparing your time for us.
Thank you so much, doctor. Thank you very much. You are very cooperative, and you really made us understand very
Thank you,
well.
doctor, for enlightening us with such a lovely talk. And I thank each one of you for making your presence here and taking out your time. Thank you so much.
Is there any way we can have the recording so that we listen to it again, just to, just to understand it a little more better, like just to recollect it? Is there a way we can have the recording? I'm just asking.
Doctor,
Yeah.
one question. Doctor, one question. Can I ask you?
Yeah, someone was asking something and not able to hear.
Yeah, doctor, I was asking you that is there any way we can have a recording of this
Yeah, I
webinar
speak to
today?
marketing team. Yeah, definitely. If they must have recorded. Yeah, I'm definitely sure. Yeah,
It is recorded.
They're on
It is
Facebook
recorded.
Live, I think. So you can go back and just click on that, so you can again see the same thing. That's what I think so is possible.
Okay, so we'll Hinduja Hospital send us a webinar link. Will they send us that Facebook link also, or we can just click on it?
Yeah,
and
the Facebook link. Okay, I'll just ask them to share again on the group chat, whatever they have.
Yeah, please, can you do that? It'll help everybody, or we can
Sure.
share it with our relatives.
Thanks all of you being there, and sorry, apologies for being late for 10 minutes. Could not be on time
Doctor,
today.
thanks a lot. This is Professor Agarwal. Thanks a lot.
Okay. Bye.
He told me, I asked a question about Seroflow. So I should not take it, or what? I couldn't understand the answer. Seroflow Rotocam 500. I'm taking from long time. Seroflow Rotocam 500.
सर आपने स्पैरोमेट्री कभी किया है, पीएफटी कभी किया है?
नहीं सर, नहीं सर।
सर करवा लीजिए, हम्बल रिक्वेस्ट है, पहले वो कर लो, बिकॉज आप जो ले रहे हैं वो आपको, बिकॉज सिंपल एग्जांपल, आपको अगर डायबिटीज है, मान लो अगर मुझे डायबिटीज है, मेरा शुगर 800 है, ट्रीटमेंट अलग होता है, 400 है, ट्रीटमेंट अलग होता है, 200 है, ट्रीटमेंट अलग है. सो ब्लाइंडली टेलिंग यू कि आप डायबिटीज का टैबलेट ले लो विदाउट नोइंग योर शुगर्स, इट विल बी हार्मफुल टू यू आल्सो.
Exactly.
So always know your lung condition first, what lung level you are having it, and then further definitely you can go ahead and get it treated properly.
Okay, so which test I should
blindly नहीं प्रोफेसर आप ले लो, एक दो बार कुछ फर्क नहीं पड़ेगा, दो ले लो, सुपेश आप ले लो,
नहीं ठीक है,
आपका शायद अस्थमा ही ना हो पहली बार.
अच्छा, तो जो टेस्ट कौन सा है ये? Which test it is? Test, what is the test?
Spirometry.
Lung function test. Okay.
Spirometry with the bronchial reversibility, they do twice with the giving a pump in between, so that is easily done, right?
Okay.
Sure.
Thank you, sir. Thanks a lot. Oh, thanks a lot.